It's exactly 351 days, just a few days to make a year, since the first COVID-19 case was detected in the country, leading to strict measures that have had far-reaching consequences. The launch of the vaccination is viewed by health experts as a breakthrough towards getting the country back on its feet.
COVID-19 vaccination is the game changer to save lives, reinvigorate livelihoods, and enable the full reopening of the economy.
From now, Uganda will, like many other countries in the world, look to vaccinate about 49.6% of the population in a phased manner, and today the health workers at Mulago and Entebbe hospitals got their shots. The rest of the medical workers will follow, and then on to teachers, security personnel, those aged 50 and above, those with underlying conditions, and other essential workers.
We may not have adequate vaccines for all these people at once, but as the vaccines come in, we shall continue to prioritize them.
But the speeches from the key figures at the launch highlighted the likely vaccination resistance they are expecting to deal with from the population.
We do appreciate that there are many things, many words, many videos circulating out there. But we are taking that responsibility on behalf of all the health workers to tell you that the first 964,000 doses of the vaccines, we are going to receive it starting with us.
These vaccines are safe.
COVID vaccines save lives.
This is really the way to go, because the vaccination is not for yourself. In the first place, it is for the people around you.
When it came to taking the jab, the minister led by example.
I want to encourage all of you to get vaccinated. There's nothing scary about it. It's just an injection.
For specific reasons, some reporters, including myself, were allowed to take the jab, and there was no resistance.
It's just normal.
So you're going to sit for 30 minutes, we observe you for 30 minutes, then we shall release you.
All right, thank you.
Perhaps something the ministry will want to see from everyone when their time comes.
And in the end, everyone among the select few rushed to have their first jab against COVID-19 after many words of assurance about the safety of the vaccine. And I doubt it was any different at Entebbe Referral Hospital, where my colleague Ivan Walunyolo spent the day. Was it any different, Ivan?
Well, Edward Muhumuza, I think the vaccination exercise has not been any different from what happened in Mulago, because actually Entebbe Regional Referral Hospital, it is the facility that handled the index case of COVID-19 when it was registered in the country here. And from today, the submissions that the hospital administration has been giving is that it has handled over 1,500 patients. The message that each one has been talking about is also not any different from what has been spoken from Mulago, that people should feel free to know that the vaccine is safe. But of course, also I can tell you that this hospital in March, actually, like I said, it handled the first case, and as we speak now, it has managed to down the number, and as I speak, there are less than 10 patients inside here receiving treatment. And according to the permanent secretary to the Ministry of Health, it's now yet to be open to the outside patients to come also receive treatment. But here it has been a success, and people are continuing to see hope, and that has been the exercise here at Entebbe Regional Referral Hospital.